As MPs vote on assisted dying, we go head-to-head on whether the British state is in a fit state to decide life and death. And with a quarter of the working age population currently out of work, 11 million people, Labour have begun the daunting task of trying to unpick that economic time bomb. But is it enough? I'm Harry Cole, and this is Never Mind the Ballots. Now, on Friday, MPs will have a free vote on the terminally ill adults end-of-life bill. It would allow those with the 6 months to live access to assisted suicide. But with critics warning it's a slippery slope, the vote appears to be on a knife edge. Joining me in the studio is former Minister Kit Malthouse, who is backing the bill, and fellow Conservative Danny Kruger MP, who's a leading opponent of the legislation. Kit Malthouse, this is a huge issue. Is one afternoon in the House of Commons really enough time to debate such a fundamental issue?
Well, it's not just one afternoon, right? As you know, Harry, this is just the start of what will be probably about a 6-month process, but it's also a point in a debate that's been happening for well over a decade. We debated this back in 2015.
When it did not pass.
Yeah, there's been lots of Westminster Hall debates. The Health and Social Care Committee did a 14-month report into it, just published in February this year, and of course there's been lots of debate out in the country. The Nuffield Foundation on Bioethics ran a citizens' jury on it. There's been lots of contemplation, but second reading is for MPs to say, OK, let's have a look at this. Let's get the legislation into detailed scrutiny, come back to the House of Commons, we'll have a look again, then it goes to the Lords, then possibly come back. So it's a long process. This is just the start.
On a personal level, why are you backing this legislation?
So for two reasons. First of all, I've long believed, basically since I was a teenager, in personal autonomy, that I think as a Conservative, we should give people as much freedom to make choices in their own lives. And there's no more profound moment that I want that choice than when I'm facing an agonising, painful death. But secondly, also over the last decade of campaigning on this issue, I've spent a lot of time with dying and bereaved people, and I've seen the horror show that people go through in the current status quo. The fact that we've got 650 people or so a year killing themselves in violent, brutal ways, one person a week going to Switzerland to kill themselves who can afford it. You know, we have a duty as a government to step in and regulate this, supervise it, bring safety for those people who are facing agony at the end of their lives.
Does it worry you, though, that the two departments that are going to have the most impact on this piece of legislation, the Department of Health and the Justice Department, the Secretaries of State of both of those departments are opposing the bill? Wes Streeting, the Health Secretary, is saying the NHS is not in a fit state, does not have the capacity to take this on. The Justice Department, are already battling massive court backlogs. You have the potential there to bring in hundreds of these very hard cases for High Court judges to have to scrutinise, and the British state just isn't in a fit condition to do this.
Well, first of all, I don't buy that argument. I mean, if you look at the Department of Health, first of all, the Palliative Care Minister, Stephen Kinnock, is out in public saying that he'll be voting for the bill and he thinks the system will cope. But secondly, also, on the health system, I don't understand the argument, right? Because these people are dying anyway. They're within 6 months of the end of their life. They're within the healthcare already. They're not some new group turning up asking for a service. And by the way, the NHS exists for patients, not the other way around. The fact that it might have a bit of hassle for them or admin, that my agony and my pain and my death might be too much for them to cope with, it doesn't make sense. And of course, the same is true at the MOJ, where the junior ministers there are supportive, even if the Lord Chancellor isn't. And there are plenty of judges. I mean, we've got the former President of the Supreme Court out this morning.
It's a divisive issue amongst judges.
Yeah, though, it is. But the point is, it is all the groups that have previously been against have now moved and now recognise the compassionate case for society accommodating the choice of those who are facing agony at the end of their lives.
Danny Kruger, the compassionate case for those facing agony at the end of their lives. You disagree, then?
Well, listen, I have great respect for Kit and for the arguments he's making. And of course, all of our concern and compassion should be for those people who are facing death and very, very worried about the pain and distress that they're going to face. But I'm afraid, yes, I do disagree with the bill. I mean, just quickly on Kit's last point about groups opposing it. The fact is that the Association of Palliative Care Doctors, who are the doctors who actually work with the dying, strongly oppose this bill because they are concerned, both on behalf of patients themselves, who they recognise could be subject to coercion either externally or their own sense of duty to do this. But also they're worried about the effect on palliative care itself, on the hospice movement, which we badly need to invest in. And the evidence from around the world is that palliative care suffers comparatively when assisted dying is introduced. The other body, by the way, which has opposed this bill, among many others, is Liberty. So the organisation, not a conservative-minded organisation, Their concern is with civil liberties and with civil rights, and they are very concerned about the impact on our fundamental freedoms of this bill. So my objections are, I mean, rather like Kit's, they're at two levels. One is about the immediate impact on patients. I'm afraid I don't think the bill is drafted with sufficient safety and rigor to ensure that people who, you or I, none of us would really expect to qualify for it, would nevertheless be able to get this assisted death. And that's what happens around the world. I'm afraid to say people with eating disorders, with diabetes, with treatable conditions are able to qualify because the concept of a terminal illness is so elastic. And my other concern is more broad. I mean, I worry about the effect on our society when the state is essentially agreeing that some people are better off dead. And then this implicit obligation that people would start to feel if that was the right course for them. And just lastly, if I may, Harry, just to Kit's point about the NHS, I mean, I rather agree with him. If the NHS, if the state decides this is what the NHS should do, of course the NHS should do it. And we'll be able to. And I actually have the opposite concern, which is that this will become something that the NHS wishes to do. I mean, historically, we've seen this. The NHS was worried about bed blocking, worried about the expense, the enormous expense that people have at the end of their lives in hospital. Will be putting people onto this pathway to an assisted death, which is exactly what's happened already with do not resuscitate orders, with the Liverpool care pathway, which had to be stopped a few years ago across the NHS, elderly people being basically assigned to death by their doctors, often without their wishes. So I'm afraid to say we're creating a very, very dangerous incentive in the system if we do this.
Kit Morehouse, the proponents of this bill, the people that have written this bill, say there are guardrails in place, but critics obviously clearly disagree with that. Are you confident that this is not going to be a slippery slope and this is just the thin end of the wedge? And once it's on the statute book, in a couple of years' time, as we've seen in other countries that have passed this legislation, campaigners will come back for more?
Well, no. I mean, there are a number of things that Danny said there, although we are friends and I respect him, that I profoundly disagree with, and the evidence refutes. So if you look at the 14-month health and social care report that was published in February this year, they said that in many territories that have assisted dying already, where it operates perfectly happily, palliative care improves. Secondly, the palliative care sector in this country is divided, for sure. We had a series of senior palliative care leaders in the House just this week talking about their view that this should be a tool that is offered. And in terms of the slippery slope, the report also said that there is no evidence that those countries that adopt the same formula we're adopting, adults with a terminal illness within 6 months, that they widen the eligibility at all. So the evidence of a cross-party, unbiased group of MPs refutes the claims that are made. But the point is, I think, a more important one is to say this, which is, if I am facing a horrible death, who should be the primary decision maker about how and when I die? Should it be a doctor? Should it be a vicar? Should it be Danny? Or should it be me? And my personal view is that I want that choice, and I want it for the dozens and dozens of people out there who I've spent time with over the last 10 years who have faced an horrendous death. Now, it's not compulsory. If you don't want it, don't have it. All I'm saying is, please give me the choice to choose the time and the manner of my own ending. It's very simple.
Good libertarian argument there, Danny. If you don't like it, don't do it.
Yeah, but I'm afraid no man or woman is an island. And the fact is that I totally respect that idea. And obviously we should be seeking to improve and widen choice and control for patients. But the fact is, if you introduce this option, and by the way, we're talking about people who are, by definition, very vulnerable. They've often had a terrible diagnosis. Mm-hmm. Their families are worried about their suffering, also, frankly, often worried about the cost that their care is going to entail. I don't think we can assume that people have automatically have total autonomy and independence of mind in that moment. And by the way, it is impossible for the doctors or the judges to determine whether they do. They're simply going to say, do I think this person is making their own decision? Then no powers of investigation, no process for them to work that out. It would be impossible anyway. So we are creating this opportunity in which I'm afraid to say, I think many, many people, and Kit talks about dozens who would benefit from this. It's unclear how many would actually make use of this new right. But I'm very conscious that there will be many, many more people who might feel compelled to take this option. And so it's not just about the people who would want it. Everybody would be compelled, would be obliged, they'd have this obligation because it's now an option. Should I be taking this assisted death? And doctors, by the way, are entitled to suggest this option to them without them raising it. So this is something that every family, every patient is going to have to consider as something that they should do for their own sake, for the sake of their families, for the sake of the NHS. And I think we are ultimately going to be diminishing control and choice and autonomy.
Okay, well, you're shaking your head.
We need is for better palliative care for everybody.
So Danny is proposing a strange reversal of what the current situation is, right? So we have hundreds of people a year killing themselves in horrible, violent ways, shooting themselves, taking overdoses, throwing themselves in front of trains because they can't face what's looking for them, what is ahead for them for their disease. We have people in hospital today refusing treatment and starving themselves to death. We've got one person a week going to Switzerland. No one at the moment is checking for any coercion. There's no supervision of that at all. What we're actually proposing is greater guardrails, safety, regulation, medical, judicial supervision for people who are facing this agonising decision at the end of their lives. And to say, well, you can't kind of trust the NHS about this. Well, if Danny is correct and he doesn't trust the NHS, surely he'd want a judge to have a look at these cases. He'd want two doctors to have to agree. He'd want greater regulation around the choice that I may make at the end of my life. And what I don't understand is people who may vote against the bill, why they are willing to tolerate this horrible situation. If the bill passes or it fails, if the bill fails, people will still be killing themselves. They'll just be doing it in brutal, horrible ways. We have to do that. We can't do something. We can't look away.
Are you sure the bill, though, are you confident this private member's bill, it's not a government bill, there's been no impact assessment. There has been, this has been sort of kind of slightly rushed process because of the way it's been done, because it is a backbench bill. Are you confident those guardrails are in place? And look at some of the legislation that the governments of multiple stripes have passed in the last 10 to 15 years. The Supreme Court is currently arguing over the definition of the word sex. Are you 100% confident, Kit Morehouse, that you believe that this piece of legislation is fit for state?
So yes, we have looked around the world at all the legislation that is operating across the world. We had Elizabeth Gardner, who pro bono drafted it. She's former First Parliamentary Counsel, the best in the business for parliamentary drafting, put it together. But the point about the vote tomorrow is to allow the bill to go forward for scrutiny by a balanced committee of the House, then come back for further scrutiny at report stage, then go to third reading for a final vote, then go to the Lords for further scrutiny. So we're not saying that it shouldn't be scrutinised or looked at or tested. We're asking for that opportunity, and a vote no tomorrow shuts the door on us even considering it any further. Now that seems to be given the reality.
That's not true, though, is it, Dave? There is a third way. Danny Kruger, do you back Gordon Brown, for example, who says, look, this is such a big issue, maybe we should slow down and have a look at perhaps a royal commission or a commission of some sorts to take it out of politicians' hands?
I do, because what I really think we need to do is to fix palliative care in this country before we consider this option, which will negatively impact palliative care. And I contest Kit's point about that, and we'll see that on Twitter, perhaps, about the effect on palliative care. And the fact is, if this goes through tomorrow, there is very little chance of any amendment. I mean, basically, it's this bill that we're voting on tomorrow. There, minor tweaks might be possible, but the bill committee will be sacked in favour of the bill. There'll be very little chance to properly amend it. We're voting not just on the overall general abstract principle of assisted dying, which lots of people can agree with. We're voting on a very concrete set of proposals which are chock full of holes. And to Kit's point about suicide, so I think this is essential. The answer to the response to the fact that some people take their own lives in terrible ways is not to help them to do so in a sort of neater or cleaner way. We have a suicide prevention strategy in this country. We don't think that people should be killing themselves. We do actually take a view as a society on that. What we think is that people should be helped to die well. And we can argue neither Kit or I are palliative care specialists. There's differences of opinion here, but overwhelmingly we all recognise that we could do death so much better. What we should be doing is ensuring that people do not suffer at the end of their life. And the overwhelming majority of people do not need to, including the great majority of cases which are brought into this debate. What those evidence of is bad care. We could do so much better with these cases, and we should not be encouraging people to think that it's either a terrible death or suicide. And certainly we shouldn't be suggesting that people are right to take their own lives. We really need to help them to die well, and we can do that so much better. Once we've done that, once we've got a decent palliative care system in this country, then by all means, if there's still an appetite for assisted suicide laws, then let's consider them. But most of the pressure for this law is because we don't do care well enough in this country.
Kit Moore, what's your response to that?
So I agree with Danny. We should be improving palliative care, but the two are not mutually exclusive. We know from experts that have appeared in the House of Commons, from the Health and Social Care Committee report, that palliative care cannot help everybody. All we are asking for is for those people who are facing agony and horror in the last 6 months of their life, the opportunity to shorten their death. It's a fundamental, profound choice that again and again and again, those actual people in that situation, living it, are asking for. Right? It's not like some technical thing. It might be for the three of us because we're healthy, but tomorrow in the gallery, there will be people with terminal diseases facing a death who are asking for this choice. And I just find it, frankly, monstrous that we would seek to deny them that relief. The other key thing to remember, of course, is that a lot of people who have the opportunity to seek an assisted death don't actually use it. But what they take from it is the comfort that they can. So if you're living with MND, if you get motor neuron disease, you know from day one that you're likely to face a horrible death. And you live with that fear, possibly for years. If you know you have the opportunity of shortening your death in a way that is compassionate and peaceful and calm, then you're released from that fear and you can live the life that you have left as joyously as is possible. And we hear that again and again and again from the people who are actually living this experience. And the point is that even if you are living this experience and you don't agree, don't choose it, right? Do something else. But we just know that the status quo is not sustainable. It needs regulation, it needs order and supervision and safety for very vulnerable people.
Kit Morehouse, one of the arguments that is often pushed against the use of the death penalty is the fact is if the state get it wrong once, then it's, it is unacceptable. Are you happy to pass this entirely on to judges and doctors who have the capacity, perhaps, to get these things wrong? And is one case getting wrong, one person coerced into it, surely that's a risk too far?
Well, the reason we have the three layers of safeguards and the periods of reflection is to make sure that we get it right. And we know from around the world, from practices like Oregon, where they've had it for 27 years, that it works. But your fundamental misunderstanding is that it's not the state doing it. They are giving the power to me to do it. It will be the individual who chooses the manner, timing, point of their own death when they're facing death anyway. And most people use it in the last few days. So the point is this is giving individuals the power and the choice. At the moment, I have the power and the choice to take my own life, but only in brutal, violent ways. I would just like some assistance to do it peacefully for me and for my family.
A question to you both, but to Danny first. On that very point, the bill is actually quite woolly on this subject. We don't know whether it's going to be how the actual end of life will be installed. Will it be privatised? Will it be free on the NHS? Will it be how do you think it's going to be actually done?
The bill does allow. It does allow for the NHS to do it. So this would be part of the National Health Service's range of treatments, as it were, services, which I think is very problematic. But leaving aside questions of conscience for doctors and so on, I think it would impact the whole way we think about the NHS. But it could become something that is done, that is outsourced. I think what would inevitably happen, as happens elsewhere, is a new sort of specialism would emerge of medical practitioners. By the way, it doesn't have to be doctors who do this, according to the bill. That's unclear, but anybody who's kind of regulated medic. So I think we'd see sort of, don't to be dramatic about it, but sort of death clinics would emerge, places where you go to get this service. And I'm afraid it's why the safeguards are not good enough, because it really is a series of rubber stamps for this paperwork. It's impossible to determine people's capacity and whether they've been coerced or not adequately. So doctors would just say, fine. Doctors who would believe in this would be the ones doing it, obviously. The judicial stage, I'm afraid, again, would either overwhelm the courts or it would just be a question of a rubber stamp. Again, no investigation possible. I think we would quickly see a sort of either definitely private services as well as NHS services emerging to provide this.
So the bill specifically excludes anybody benefiting or making a profit from the service. It would have to be offered as part of the NHS. The system wouldn't be overloaded. When we brought in heart transplants all those years ago, there was the same argument used. We can't have them because it'll overload the NHS, it'll suck in too much resources. That's just not true. And these people are already in the system. They are already receiving treatment because they are likely to die within a few months. I just can't see that there is anything wrong with giving the tragedy or injecting choice into the tragedy of someone facing a horrible ending. It's a fundamental part of life that I should be able to choose the manner and place of my death. And at the moment, we have a system which is completely unsafe. There is no checking. Well, in fact, we check for coercion, but we check for coercion after people are dead, which is too late. Right? We want the checking to happen before. We want doctors, judges to be involved in that decision. We want people to be evaluated before they do what they're currently doing already. And we want humanity and compassion for those people rather than a kind of somebody else deciding the manner of death that they're facing.
One sentence each, final word. Danny Kruger, are we going to be back here in 5 years debating expanding this bill if it passes, yes or no? And same question to Kit, but Danny first.
Well, it has the seeds of expansion in it already. And yes, certainly, once you've decided that people have a human right to this, then every so-called safeguard that stops other people getting it would become a barrier, discrimination that would need to be overcome. So, of course, it would expand progressively. That's the way of these things.
Kit Mulhouse, are we going to be challenging
we will be back in 5 years, but not for expansion. The bill contains a requirement for the government to review the operation of the bill over the first 5 years, as well as producing annual reports in between into how it's run. The bill is drafted so tightly. I mean, Danny can't object, as he has earlier, to it not being amendable, and then say it's somehow going to be expandable.
Labour majority, is almost unamendable for some people. They will be able to stack their.
No, if you understand the legislation, it's drawn so tightly, and the title is drawn so tightly that it cannot be. Eligibility could not be expanded by subsequent amendment. We've tried to do that specifically to address some of the concerns that people have raised about expansion. So no, I don't think we will, but we will be back in 5 years to look at how it's operated.
Danny Kruger, Kit Mulhouse, a debate that's going to rage on tomorrow through the House of Commons and perhaps even longer than that. Don't go away. Next up, Benefits Britain. Now, 9 million people are economically inactive, almost a third due to long-term sickness. Joining me now is Fraser Nelson, former editor of The Spectator, and one of our foremost thinkers on the subject of Benefits Britain. Fraser, we'll get to how we got into that mess in a moment, but before we do, I just want to get your reaction to the new net migration statistics. It's been revealed that net migration has now been revised up again to 906,000 for 2023. That's a city the size of Birmingham arriving. It's dropped 20% for 2024, but still stands at 728,000. That's completely unsustainable, isn't it, Fraser?
Well, of course, it's coming down. I mean, this will be the peak. But the funny thing is just how much bigger this peak is than what they thought it was recently. I mean, the city of size of Birmingham might have come in, as you say, but you can bet the house building has not been that of a city the size of Birmingham. So there are obviously practical things here. But what really strikes me here is that after the new Brexit system that we got, where everybody, whether they're American, Australian, or French or German, are all supposed to come for the same kind of visa system on a salary basis, how the officials had absolutely no idea, not just how many would come, but how many had come. Even now, we're trying to get a handle on how many actually arrived during the last year of Conservative government, and the answer seems to be almost 1 million. Remember when David Cameron said he wanted it down in the tens of thousands? Now, this, of course, was a mistake. The Conservatives never, ever intended for this to happen. But by the time everybody was coming, they'd worked out. But they'd put their Brexit settings far too low. Now, they have adjusted, so I think we'll see this number probably half in the next year or so. But I think this was a mistake for which the Conservatives paid justifiably and dearly.
James Cleverly, Rishi Sunak, they have the scars on their back of the last year of trying to get some of those restrictions on things like salary thresholds, bringing in dependents. I mean, the political capital they had to spend to just get the number down by 20%. Do you think they've done enough, or is this Labour government going to have to do more? And not a government that naturally hasn't much of an appetite for controlling migration.
Oh, I think the Labour government will have to do more. I mean, the things which blindsided the Tories, for example, was not so much the people coming in individually, it's their dependents, their spouses, the families that were bringing in, even by students. That completely threw them. So what you need to adjust there is, for example, the earnings threshold for somebody's spouse. Now, the government hasn't yet accepted the recommendations to increase this to the mid-30s, but I think they're probably going to have to. Of course, the question now is how much can you rely on the forecast that this is going to come down quite quickly? If you look at the Office of Budget Responsibility, they say it's fine, it's coming down really fast, although it's going to settle at 300,000 a year, which isn't exactly very low. But the OBR has showed its own record in forecasting this is absolutely dreadful. The OBR wasn't just the Tories. I mean, everybody got this migration forecast completely and utterly wrong. And it suggests that no matter what you think the number is going to be, the real number is going to be a lot higher.
Boris Johnson came on this show not long ago and made a fairly watery argument, I might say, about the fact that he had to throw open the borders after COVID to sort of help getting inflation down, help fix job shortages. This is going to be a significant blot on an already fairly blotted legacy for the former Prime Minister, isn't it? The man that promised us to take back control and has given us a city the size of Birmingham.
Well, that's how he torpedoed his own agenda. What Boris Johnson should have done is taken the Brexit vote and forged it into a political agenda. Now, that was quite easy to do. You'd have said to employers, look, so far, you've been basically using fairly cheap migrant labour to fill your workforces. Look at the care homes. You're paying unskilled wages for a skilled job. This can't go on. So from now on, we're going to turn the immigration tap right down, and you're going to squeal. You're not going to like it. But you're either going to have to raise wages, automate, or train British workers, or you need to use the vast pool of unused labour in the UK economy. Now, that would have been very difficult for them, and it would have put the government in a tight spot. They would have get business saying, look, we can't find care home workers, we can't find waiters for the restaurants, etc., and the nursing staff. And what happened was the Tories buckled. That rather than have the nerve to force through a kind of adjustment to a more cohesive economic model, they basically caved and they gave employers all the immigration that they wanted. I think looking back, it's quite clear that this was the moment where it could have been a painful transition, but nonetheless, in my view, a necessary transition to a higher wage, higher skilled economy that forced employers to look at Britain's own unemployed, not just those claiming unemployment benefits, but those in sickness benefits as well, and seeing what they could do to get people back into work. Now, if this were 20 years ago, it would be a crisis that we had 3 million people in sickness benefits. There's no way we could grow the economy. But we're used to saying now, well, if there's worker shortages, then let's just take in immigration. Demographic changes mean there's a huge pool of immigrants, not just from the EU, from all over the world, still willing to come in. The result, though, is that this is too much of a good thing. This allows the employers to basically ignore the British workless, and worst of all, it allows British politicians to ignore the British workless.
On that, I mean, unless you do it to your heart, and an issue perhaps the statistics we can get into might not be as accurate as those migration figures, but the government's white paper this week, we'll get into its recommendations, which I think, again, talking of woolly, were pretty thin gruel. But let's look at some of these numbers. 1 million people aged 16 to 24, not in education, employment or training. That's one in eight of every young people. You've been writing this week about 3,000 people a day being signed off to sickness benefits. You know, this sort of ticking economic time bomb, coupled with the massive influx of migration, as you say, how is any minister of any stripe, of any colour, going to get a grip on this before it's too late?
Well, the problem is that the leisurely timescale they seem to give it. I mean, Liz Kendall was coming out this week with her reform. Now, she seems to understand the problems very well, but she was saying it's not going to be next year until we see the sickness benefit reforms. Now, every single day, as you say, 3,000 people are being signed onto sickness benefits, pretty much written off. And the figures suggest that the figures are going to go from 3 million last year to 4 million in just 4 years' time. Now, that isn't sustainable economically, socially, even morally. It's just a dreadful way of running an economy. But until you actually get the system changed, it's going to keep on going. Now, on Liz Kendall's timetable, say she comes out with the best idea in the world in the middle of next year. By the time she's been through the courts and the judicial reviews, because all the charities will sue her and fight her, it might be 2026, 2027 until we actually get this obviously failing system reformed. And the amount of damage that will be done by then is just huge. So there are some things that can be put off for better political times, but this isn't one of them. This really can't wait.
The Tories identified in their manifesto before the last election around £12 billion worth of cuts to the benefit system. Some people said that was a little bit toppy, but Liz Kendall seems to be identifying perhaps £3 billion to be reformed in PIP, in disability benefits. Do you think that number's credible, and would that be enough to sort of turn the tide, if to use a phrase?
Oh, well, no, 3 billion wouldn't be anywhere near enough to turn the tide. I mean, when you actually include all ages, like children and the disabled group, the actual benefits bill is going to be heading over £100 billion.
That's more than we spend on policing, it's more impacting what we spend on defence, you know.
Yeah, absolutely. So shaving 3 billion quid off here and there is as nothing. I mean, right now, the best the Starmer government can hope for is to stop the rise. We're right now on the cusp of a calamitous rise and the number of people being written off and the waste in human lives, let alone money, is absolutely staggering. If it can just stop that rise and keep things where they are now, which is a pretty bad situation, that would save all the money that they would need. Because right now, if you have a look at this, the OBR is doing a very good job in saying, look, we've joined the dots here, and this is how much you're going to be spending in 3 years' time, 4 years' time, 5 years' time. It's going to go up by an absolutely huge amount. And this is way more than the tax rises you've just come through, unless you can actually stop the damage which the welfare system is inflicting on the country.
Who is to...
now,
yeah, go,
sorry.
Carry on, please.
No, and that is, of course, that's the opportunity. But I mean, you can shave this here and there and try to take away this benefit and that benefit. But this should be about saving lives, not saving money. If you save the lives, then the money will look after itself. But right now, I mean, for my documentary, which is coming out on Channel 4 next week, I spoke to so many people claiming sickness benefits who really want to work. But the system is not geared at helping them work. The system is geared at keeping them where they are and putting big penalties in their way if they ever have the temerity to learn a trade, try to find a way out. So the system right now is geared towards getting people on these benefits, giving them the check, and then forgetting about them. And it's that system where the money is being spent, that system is where the lives are being wasted, and that system that needs to change.
Who do you blame though for this? I mean, we've seen some startling figures in the white paper that 1 in 5 people on sickness benefit are now under the age of 24. They're obese. They're suffering from mental health problems. Is it too easy? We've seen it's very easy to get onto the sickness benefits. It's very hard to get off them. Are GPs perhaps doing enough to really scrutinise people's claims, or is it just rubber stamping and off they go?
Well, the GPs can't be blamed. There is such a thing as a fit note. That's the first step. 95% of them are granted. But the GPs, I spoke to a GP for the film, who said that he doesn't want to be the DWP police. Yeah. That this isn't their job, nor should it be. Now, the problem is what's called the work capability assessment. That's the real test process to see if somebody's going to qualify or not. And that is a phone interview. And I spoke to people doing these assessments who've got grave ethical concerns about how many people they are writing off in the course of a day on pretty spurious criteria. But not even, how are you supposed to tell via a 20-minute, 30-minute phone call if somebody really is so anxious, so depressed, that they're not capable of doing any work? And yet this is the judgment which right now the government is asking people to make via private companies. And what's more, they're incentivized. They're paid an extra £80 for every extra person that they process. Now, they're never holed up on those they categorize as being sick. They're always holed up on those that they don't give benefits to, because those people might appeal. The appeal costs money for the private company who's doing the assessment. So this work capability assessment protest is where the real corruption lies. And in the documentary, we didn't have too much difficulty finding people who did this for a living and were just repelled by what they were asked to do and resigned as a result.
When you read the white paper, having spent the last few weeks, months working on this film, and finding this shocking things, corruption as you put it there, and then you read this white paper that talks about a £45 million trial scheme to have the Royal Shakespeare Company training people. Does it seem to you, from where you're sitting, that the ministers are even close to understanding what if the British public knew the truth and reality of this, is a truly shocking state of affairs?
I don't think this penny has dropped for quite some time. I mean, take Boris Johnson, we spoke about earlier. He presided over something like 500,000 more people went on to sickness benefits when he was Prime Minister. And on his last day at number 10, he was boasting about unemployment was the lowest since the 1970s. So even he was talking about the reverse of what had actually happened. Now, the Labour government didn't work it out either, but the problem is that what needs to be done now, reforming sickness benefit, is the hardest task in politics. Even Ian Duncan-Smith stopped short of doing what was probably necessary to change that system, because the charities are going to come after you. Now, if you reassess, for example, 2 million people and you have a 99% success rate, you've still got tens of thousands who aren't going to be able to do it properly.
Why are we an outlier there? I mean, if you look at other European countries or other countries of similar sized economies, our bill is higher than theirs. What is it about Britain that has got this so wrong? Are we too tolerant, perhaps, of, sort of mental health concerns or, post-COVID reasons of people that got used to working from home and then just didn't want to go back to work? What have Britain got wrong? We appear to be the sort of stay-at-home man of Europe.
Well, if you look at right around the world, we're the only country experiencing the surge in sickness benefits. The Institute for Fiscal Studies did a report a few weeks ago, finding that all these countries, who also went through lockdown, who also went through mental health is rising worldwide, all of them are managing to reduce the number of people on sickness benefits. That's simply because they invest more before talking to somebody to work out, are you really not fit to do any work? With us, it's a tick box exercise. People are paid for how many they can process a day. The weird thing is, it's costing us so much money because we're not spending enough money in the process, giving these people the care, the attention, and the consideration they need. They deserve, at the very least, a face-to-face interview. We're not even getting that. So when you look at the problems, you show me a country that isn't showing a rise in antidepressants, a rise in people reporting mental health attitudes. I mean, the conversation around this has changed a lot. People are way more likely to talk about mental health, and that's a good thing. But what's happened is that our benefit system, our health system, is way too quick to say, okay, in that case, we're going to categorize you as unfit for any work. Now, that's the problem. We're facing the same health background as all other developed nations are facing, but our systems have been discombobulated by the rise in mental health with pretty bad results for communities. There's some places in Britain where a third of the community are on sickness benefits, almost a third. Places like Grimsby, some parts of Blackpool, some Easterhouse in Glasgow. Now, that is something which can only be created by a very, very bad system, and one that's simply been neglected by politicians of all parties for way too long.
Fraser, just before I let you go, get your plug in for your film, Channel 4. When is it? When's it out? And when can we watch it?
It's on at 8 o'clock this Monday, and Channel 4 dispatches Britain's benefits scandal. And the scandal is that people are now trapped by a system that's supposed to be helping them.
And just before I let you go, are you confident that if you came back here at the end of this Parliament, 4 years' time, this system will be reformed, or will we still be debating it? Is there a political will in this government, and is the opposition strong enough, do you think, to drive this issue and give it the credence it deserves?
Well, it's difficult for the Tories to be outraged about this because everything we've just been talking about happened under their rule. Now, I think Labour will have no choice but to reform. And we hear, by the way, that Keir Starmer is planning a speech next week about some kind of new beginning, a new start. I don't know if he's planning to reset his government already, but he does have 5 years to do it. He's still got a long time to actually get this right if he can find the political courage to do it.
What is the point of a 160-seat majority unless you're going to use it? Fraser Nelson, thank you very much. That's all we've got time for. Fraser Nelson, thank you very much. Looking forward to your show. Subscribe, youtube.com/The Sun to never miss ours. Thank you to all of our guests this week. See you next time.